I want to tell you something today that I believe is one of the most important and most urgently needed conversations in all of senior healthcare. And it is a conversation that most doctors simply do not have enough time to have with their patients during a routine 15-minute appointment. If you are over 65 and you take any kind of regular medication, what I am about to share with you could protect one of the most vital organs in your body. An organ that is quietly, silently, invisibly doing some of the most important work in keeping you alive every single day. An organ whose decline, when it happens gradually, produces almost no symptoms until it is dangerously advanced. And an organ that 4 of the most commonly prescribed and most commonly purchased over-the-counter medications in America are actively damaging right now in millions of seniors who have no idea it is happening. I am talking about your kidneys. My name is Dr. Wells. I have spent over 2 decades working with older adults and studying the specific ways that aging changes the body's relationship with medications. And in that time, the issue of medication-related kidney damage in seniors has become one of my greatest concerns. Because it is so common, because it is so preventable, and because it is so consistently invisible until it is too late to fully reverse. Today, I am going to walk you through the 4 most common medications that are silently destroying kidneys in adults over 65. I am going to explain exactly how each one causes kidney damage at the biological level, and I am going to give you the specific questions you need to ask your doctor to protect your kidneys starting at your very next appointment. Stay with me until medication number 3, because that one is in almost every American medicine cabinet. It is sold without a prescription, and most people who take it regularly have absolutely no idea it is one of the leading causes of kidney damage in older adults. Let us begin with a brief explanation of why the kidneys are so specifically vulnerable after 65, because understanding this changes everything else. Your kidneys perform functions that are absolutely essential to life. Every single minute, your kidneys filter approximately 1 liter of blood, removing waste products, excess fluids, and toxins, while returning clean, properly balanced blood to the circulation. They regulate blood pressure through multiple hormonal mechanisms. They maintain the electrolyte balance, the precise concentrations of sodium, potassium, magnesium, and other minerals that your heart, muscles, and nervous system depend on to function. They produce hormones that stimulate red blood cell production, and they activate vitamin D, making it available for use by bones, muscles, and the immune system. After the age of 40, kidney function begins to decline slowly and naturally. By the age of 70, most adults have lost between 30 and 50% of the kidney function they had at their peak. This decline happens quietly, without symptoms, and without any awareness on the part of the person experiencing it. The kidneys have remarkable reserve capacity. They can lose more than half their function before any obvious symptoms of kidney disease appear. This reserve capacity is a biological gift, but it also creates a dangerous vulnerability because it means that significant kidney damage can accumulate for years before anyone notices. And the medications that damage kidneys do so gradually, incrementally, and silently, adding their harm on top of the natural age-related decline that is already occurring. When medication-related kidney damage is combined with age-related kidney decline in a 70-year-old, the cumulative effect can push kidney function across the threshold into chronic kidney disease without any single dramatic event, without any obvious symptoms, and without anyone connecting the declining kidney function to the medications the person has been taking for years. This is what I want to prevent. And the knowledge I am sharing today is the most powerful tool available for preventing it. The first medication that is silently destroying kidneys in adults over 65 is NSAIDs, non-steroidal anti-inflammatory drugs. You know them by their common names: ibuprofen, naproxen. These medications are available without a prescription at every pharmacy and grocery store in America. They are taken daily by millions of seniors for joint pain, arthritis, back pain, and headaches. And they are causing kidney damage in older adults on a scale that most people find genuinely shocking when they hear the numbers. Here is exactly how NSAIDs damage kidneys. Your kidneys depend on a group of compounds called prostaglandins to maintain adequate blood flow through the delicate filtering structures within them. Under normal circumstances, prostaglandins help dilate the small blood vessels that supply the kidney's filtering units, ensuring that the kidneys receive the blood flow they need to function properly. NSAIDs work by blocking the enzymes that produce prostaglandins throughout the body. This is how they reduce pain and inflammation. But in blocking prostaglandin production in the kidneys, NSAIDs cause the blood vessels supplying the kidney filters to constrict. Blood flow to the kidneys falls. The delicate filtering structures are deprived of the oxygen and nutrients they need, and kidney function declines. In healthy young adults with robust kidney function, the kidneys can generally compensate for this prostaglandin blocking effect. But in adults over 65, whose kidneys are already operating with reduced reserve capacity, this compensatory ability is dramatically diminished. The kidney blood flow reduction caused by NSAIDs hits aging kidneys much harder and causes much more damage than it does in younger kidneys. Additionally, NSAIDs cause the kidneys to retain sodium and water, raising blood pressure and increasing the fluid load that the kidneys must process. In older adults with any degree of pre-existing kidney compromise or heart failure, this effect can trigger acute kidney injury that can be severe and rapid in onset. A large study published in the American Journal of Kidney Diseases found that regular NSAID use was associated with a significantly increased risk of chronic kidney disease development and progression in adults over 60. And a study in the British Medical Journal found that NSAID use was one of the most common triggers of acute kidney injury requiring hospitalization in older adults. What should you do? If you take ibuprofen or naproxen regularly for pain, speak with your doctor about safer alternatives. Acetaminophen, which is Tylenol, is generally considered significantly safer for the kidneys and is often an effective alternative for pain management in older adults. Topical NSAID preparations, which are applied directly to painful joints, provide local pain relief with far less systemic absorption and dramatically lower kidney risk. And addressing the underlying causes of pain through physical therapy, anti-inflammatory nutrition, and other non-pharmacological approaches can reduce or eliminate the need for pain medication entirely. The second medication that is silently destroying kidneys in adults over 65 is certain classes of antibiotics, specifically aminoglycosides and certain other antibiotic classes that are used to treat serious infections. This is a more specific and more clinical category than the others I will discuss, but it is critically important because antibiotic-related kidney damage is one of the most common and most preventable causes of acute kidney injury in hospitalized older adults. Aminoglycoside antibiotics, which include drugs like gentamicin, tobramycin, and amikacin, are directly toxic to the cells lining the tubules of the kidney. These tubular cells are responsible for the fine-tuning of what the kidneys filter, reabsorbing useful substances and concentrating waste products for elimination. When aminoglycosides damage these cells, kidney function can decline rapidly. In younger adults with robust kidney function, this toxicity is manageable with careful dosing and monitoring. In older adults with age-related kidney decline, the risk of serious aminoglycoside-related kidney damage is significantly elevated. The kidneys of older adults are less able to compensate for the tubular damage these antibiotics cause, and the damage accumulates more rapidly and more severely. Additionally, certain other antibiotics, including some fluoroquinolones and sulfonamides, can cause kidney damage through inflammation of the kidney tissue and through the formation of crystals within the kidney tubules. What should you do? If you are hospitalized and treated with antibiotics, you have the right to ask your medical team what antibiotics you are receiving and whether kidney monitoring is being performed. If you are prescribed any antibiotic for an outpatient infection, ask your prescribing doctor whether your kidney function has been considered in the choice of antibiotic and the dose. And if you experience any significant changes in urination, unusual swelling, or back pain near the kidney area during or after an antibiotic course, report these symptoms to your doctor immediately. And now we have arrived at medication number 3, the one I promised you, the one that is in almost every American medicine cabinet, the one sold without a prescription, the one whose connection to kidney damage is known by every nephrologist and every pharmacist, and yet is almost never communicated clearly to the seniors who take it most regularly. Medication number 3 is proton pump inhibitors, PPIs. You know them by their brand names: omeprazole, which is Prilosec; esomeprazole, which is Nexium; pantoprazole, which is Protonix; lansoprazole, which is Prevacid. These medications are taken by tens of millions of Americans for acid reflux, heartburn, and gastroesophageal reflux disease. Many people have been taking them daily for years, some for decades, and most of them have never been told that research published in some of the most respected medical journals in the world has linked long-term PPI use to significantly increased risk of chronic kidney disease, acute kidney injury, and end-stage renal disease. Let me explain the mechanisms through which PPIs damage kidneys, because there are several. The first mechanism is a condition called acute interstitial nephritis. This is an inflammatory reaction within the kidney that can be triggered by PPI use. The immune system mounts an inflammatory response within the kidney tissue, damaging the structures responsible for filtration and concentration. Acute interstitial nephritis from PPI use often presents without obvious symptoms and is frequently discovered only when blood tests reveal declining kidney function. If identified promptly and the PPI is discontinued, the condition can sometimes resolve. But if it goes unrecognized and the PPI continues, it can progress to permanent kidney damage. The second mechanism is hypomagnesemia. Long-term PPI use significantly reduces magnesium absorption from the gut. As I discussed in relation to muscle health in a previous video, magnesium deficiency has direct negative effects on kidney function and has been associated with accelerated kidney disease progression. PPIs also impair the absorption of other minerals critical for kidney health, including calcium and potassium. The third mechanism is indirect, through the effect of PPIs on the gut microbiome. Long-term acid suppression profoundly alters the composition of the gut bacterial community in ways that research is now linking to increased systemic inflammation and metabolic dysregulation, both of which negatively affect kidney function over time. A landmark study published in the Journal of the American Society of Nephrology that followed more than 170,000 adults found that PPI users were 28% more likely to develop chronic kidney disease and 96% more likely to develop end-stage renal disease compared to non-users, after accounting for other kidney disease risk factors. Another study published in JAMA Internal Medicine found that PPI use was associated with a significantly increased risk of acute kidney injury. These are not small or marginal risks. They are clinically meaningful risks that are affecting millions of older adults who were never told about them when their PPIs were prescribed or when they started purchasing them over the counter. What should you do? If you are taking a PPI daily and have been doing so for more than 8 weeks, have a conversation with your doctor about whether you still need it and whether a lower dose or an alternative approach might be appropriate. Many people who started PPIs years ago no longer have the active reflux symptoms that originally justified the prescription. H2 blockers, such as famotidine, which is Pepcid, are an alternative for acid management that does not carry the same kidney risk profile. Dietary and lifestyle modifications, including weight loss, elevating the head of the bed, avoiding meals within 3 hours of bedtime, and reducing trigger foods can significantly reduce acid reflux without any medication. And have your kidney function tested specifically if you have been on a PPI for more than a year without a kidney function check. The fourth medication that is silently destroying kidneys in adults over 65 is certain blood pressure medications, specifically when not properly monitored and managed for the aging kidney. I discussed ACE inhibitors and ARBs in the context of blood pressure management in a previous video, but their connection to kidney health deserves specific attention here because the relationship is complex and critically important. ACE inhibitors like Lisinopril and ARBs like Losartan can be genuinely kidney protective in certain clinical situations, particularly in patients with diabetic kidney disease where they reduce the damaging pressure within the kidney filters. In these situations, they are among the most important medications available for slowing kidney disease progression. This is a genuine and important benefit. However, the same mechanism that makes them kidney protective in certain situations makes them kidney damaging in others. ACE inhibitors and ARBs work partly by dilating the outflow vessels from the kidney filters. This reduces the pressure inside the filters in a way that protects them from the damage caused by sustained high pressure. But in patients who have significant narrowing of the arteries supplying the kidneys, or in patients who are significantly dehydrated, or who have very low blood pressure, this outflow vessel dilation can reduce kidney blood flow to dangerously low levels, causing acute kidney injury. This risk is specifically elevated in older adults because of three factors that commonly occur together. Arterial stiffness and narrowing increases with age. Dehydration is more common in older adults because the sense of thirst diminishes. And older adults are often on multiple blood pressure medications that together can lower blood pressure more than intended. The result is a pattern that nephrologists see regularly. An older adult on an ACE inhibitor, or ARB, who becomes mildly dehydrated during a hot summer, a gastrointestinal illness, or simply by not drinking enough fluids during a busy day, develops acute kidney injury that may or may not fully resolve. What should you do? If you take an ACE inhibitor, or ARB, know that your kidney function and potassium level should be checked regularly, at minimum, every 6 months. Stay adequately hydrated, particularly during hot weather, illness, or any situation that increases fluid loss. If you experience significant vomiting or diarrhea while taking these medications, contact your doctor promptly about whether to temporarily hold the medication until you are fully rehydrated. And if you experience any unexplained changes in urination, unusual swelling, or significant fatigue, have your kidney function tested promptly. So let us bring everything together. The 4 medications most commonly causing silent kidney damage in adults over 65 are these. Number 1. NSAIDs including ibuprofen and naproxen, which reduce kidney blood flow by blocking prostaglandins, and which are taken regularly by millions of seniors for pain without any awareness of the kidney risk. Number 2. Certain antibiotics, particularly aminoglycosides, which are directly toxic to kidney tubule cells and which require particularly careful dosing and monitoring in older adults. Number 3. Proton pump inhibitors, including the widely used Prilosec, Nexium, and Prevacid, which cause kidney inflammation, impair mineral absorption, and are associated with significantly increased rates of chronic kidney disease and kidney failure with long-term use. Number 4. ACE inhibitors and ARBs, which are beneficial for kidney health in certain situations, but which can cause acute kidney injury in older adults who become dehydrated or who have arterial narrowing affecting kidney blood supply. Here are the 5 questions I want you to bring to your next doctor's appointment. First, has my kidney function been tested in the last 6 months? If not, can we test it today? Second, are any of the medications I take regularly associated with kidney damage? And are you monitoring my kidney function with this in mind? Third, I take over-the-counter ibuprofen or naproxen regularly for pain. Are there safer alternatives that would not put my kidneys at risk? Fourth, I have been taking a PPI for acid reflux for more than a year. Is it still necessary? And has my kidney function been monitored while I have been taking it? Fifth, given my age and my current kidney function, are there any medications I am taking that should be at a lower dose or that should be reconsidered entirely? Your kidneys are filtering your blood every moment of every day. They are working silently, without complaint, without any outward sign of the cumulative damage they may be absorbing. Please give them the protection they deserve. Ask the questions, monitor the numbers, and make the changes that keep these essential organs functioning for all the years ahead. Subscribe to Dr. Wells' Healthy Aging. Share this video with every senior you love, and I will see you in the next video. I am Dr. Wells. Take care of your kidneys, because they are taking care of you every single moment, and they deserve that care in return. Before I close today, I want to address something that I know many seniors feel when they watch videos like this one, and that is a sense of overwhelm. A feeling that there is so much to worry about, so many medications to question, so many numbers to monitor, that the whole subject of medication safety feels more frightening than empowering. I understand that feeling, and I want to offer you a different perspective. The goal of everything I share in these videos is not to make you afraid of your medications. Most of the medications seniors take are genuinely beneficial and genuinely necessary. Metformin controls blood sugar and prevents the devastating complications of uncontrolled diabetes. Blood pressure medications prevent heart attacks and strokes. Acid reflux medications prevent the pain and esophageal damage of severe reflux disease. These are real benefits. They are saving lives and protecting health every single day. The goal is not fear. The goal is informed vigilance. The goal is knowing enough about what your medications do and how they interact with your aging body to ask the right questions, to advocate for appropriate monitoring, and to recognize when a side effect or a risk that once seemed acceptable has become a greater concern at 70 than it was at 55. The human body is extraordinarily adaptable, and modern medicine, when practiced with full awareness of the specific needs and vulnerabilities of older adults, has extraordinary tools for managing chronic disease while protecting organ function. But those tools work best when patients are informed participants in their own care, when they know what to ask, when they know what to monitor, when they know how to recognize that something has changed and bring it to their doctor's attention. That is what I am trying to help you become: an informed, empowered, actively engaged participant in your own health. Not a passive recipient of prescriptions written without full consideration of your age, your kidney function, your other medications, and the cumulative reality of your aging body. There are a few additional practical steps I want to leave you with today that go beyond the 5 appointment questions I already shared. First, keep a complete and current medication list. This means every prescription medication, every over-the-counter medication including pain relievers, antacids, antihistamines, and sleep aids, every vitamin and supplement, and every herbal product. Update it whenever anything changes. Bring it to every medical appointment. Share it with every new doctor or specialist you see. Medication interactions and cumulative kidney effects almost always involve combinations of drugs, and no individual prescriber can protect you from combination risks if they do not know everything you are taking. Second, know your kidney function number. Ask your doctor for your most recent eGFR, which is your estimated glomerular filtration rate. This is the standard measure of kidney function. An eGFR above 60 generally indicates adequate kidney function for most medication decisions. An eGFR between 30 and 60 indicates moderate kidney disease and requires dose adjustments for many medications. An eGFR below 30 indicates severe kidney disease and requires major medication reviews. Know your number, track it over time, and if it is declining, have an explicit conversation with your doctor about what that means for each medication you are taking. Third, stay consistently hydrated. Dehydration is one of the most common and most preventable triggers of acute kidney injury in older adults, particularly those taking NSAIDs, ACE inhibitors, ARBs, or diuretics. Aim for at least 6 to 8 glasses of water daily. During hot weather, illness, or any situation that increases fluid loss, increase this significantly. And if you are ever significantly vomiting or experiencing severe diarrhea while taking kidney-affecting medications, contact your doctor about whether to temporarily pause those medications until you are fully rehydrated. Fourth, have your kidney function tested after any major illness, surgery, or hospitalization. These events can cause acute kidney injury that may not produce obvious symptoms, but that can significantly change your kidney function baseline and the safety profile of your ongoing medications. And fifth, find a doctor who will have this conversation with you. Not every physician has deep expertise in geriatric pharmacology. Not every physician has the time within a standard appointment structure to review all of your medications through a kidney protective lens. But every physician should be willing to engage with you when you raise these concerns, to order the monitoring tests you request, and to take seriously your desire to understand and protect your kidney health. If you consistently find that your concerns are dismissed, that your questions about medication safety are not taken seriously, or that nobody seems to be looking at the big picture of all your medications together, it may be time to seek a second opinion from a physician with specific expertise in geriatric medicine, or from a nephrologist who specializes in kidney health. You have one pair of kidneys, and they have been filtering your blood faithfully for every decade of your life. They deserve your attention. They deserve your protection. And they deserve a medical team that takes their health as seriously as you do. I am Dr. Wells. Thank you so much for spending this time with me today. Please share this video with every senior you know who takes regular medications. The information in this video could protect their kidney function, prevent serious illness, and genuinely extend the quality and length of their lives. Subscribe to Dr. Wells' Healthy Aging. Click the like button, and I will see you in the next video. Take care of your kidneys. Take care of your whole magnificent self, because you deserve to be healthy, informed, and fully protected at every single age.